Hello, I'm Ayush Arora. I'm one of the interventional cardiologists at CIS Thibodaux. I was born in a small community in North India, and I grew up there and went to medical school in New Delhi. After that, I decided to come to US for further training. I did my internal medicine in New Jersey, cardiology at University of Texas in Houston, and I did my interventional cardiology at Mount Sinai in New York. As I was interviewing in the area, my vision of providing care to my patients was coincided by Dr. Walker's and CIS mission statement. I was deeply touched by it, which was to provide the best possible cardiovascular care to the patients in our community using the most updated technology and keeping their best interest and safety in mind. That's how I happen to be in CIS Thibodaux. The two most interesting things I find in cardiology is prevention and doing CHIP, and I'll give the reasons for each of them. Prevention, because I want to see the patients before they need any cardiovascular procedures or interventions. If you talk to my patients, they'll tell you how much time we spend talking about risk factor modifications and lifestyle changes, including medication changes that can negate or delay the need for any cardiovascular procedures or intervention. Number two is CHIP, or complex high-risk indicated PCI. So there are a lot of patients in our community and elsewhere who have blockages in their heart arteries, and they suffer from chest pain and shortness of breath. These blockages are also the number one reason for cardiovascular death in the country. Now, a lot of these patients have complex anatomy or calcified arteries or being high risk in general, and they cannot have bypass surgery or cannot get the traditional ways of opening these arteries. So I trained in Mount Sinai and spent a significant amount of time taking care of these patients to perform all these indicated and high-risk procedures to open up their arteries. And I would love to continue doing that and contribute with my skills to the community. Family for me is my wife and my daughter. My wife is a pediatric ICU doctor in New Orleans, taking care of sick patients in Children's Hospital. My daughter, she's a 20-month-old toddler, and she is the most beautiful gift to us by God. Anytime out of work, I love to spend with my family, with my wife and daughter, try new restaurants, cafe, and travel with them, watch movies, TV series, and just have a good time with my family. I'm passionate about sports. I follow cricket, soccer, tennis, and I'm slowly getting used to American football. I'm excited to join Cardiovascular Institute of South in Thibodaux, and I'm looking forward to taking care of all cardiovascular needs in the community.